how do we design the study trial, and how do we implement the study, and then ultimately how do we get to the end result, which is helping out a patient. That dance that happens between developing a drug and creating a clinical trial.
Clinical trial design in this space is quite unique. And the way, one way I see it is especially unique is really the unique power of these particular medicines. Maybe the most obvious way that translates into the clinical trial design is the use of the sort of placebo control study and how that might look. Because really in psychiatry and other areas of mental health research, typically the effects of the active medicine are relatively, in fact, small compared to the placebo. If we look at classic antidepressant drugs, for example, reviews, meta-analyses looking at research for decades now, essentially suggest these medicines might give us about a 10% advantage, more or less, of a clinical effect for the active medicine, the antidepressant, as compared to the placebo. But in this case, with drugs like psilocybin, actually it appears from the early trials published only in the last few years that the clinical effects are quite extraordinary and far superior to the placebo. And essentially, as one is administering the drug in the session while the patient is experiencing the effects, those effects are so obvious as compared to the placebo that the choice of the placebo is difficult. So this is, of course, positive result for these kinds of medicines, these kinds of interventions. But in terms of the clinical trial design, it creates some complications. And so what is the control group? What is the placebo in this case? That is an interesting question. I don't know if the others have some comments on that.
Yeah, I think Paul is really nicely hitting the nail on the head as far as the gap that we're really trying to design these studies to fill. So we have, the current standard of care that's only, slightly better than placebo, like was really nicely just described. And then we have what are effectively products of nature that are showing, vast improvement possibly, but haven't really been thought of in a modern pharmaceutical lens at all. And so there's, both a character of how do we design the studies to understand that potential in the product of nature, but then how can we also take the last, 100 years of pharmaceutical development and drug design chemistry and apply that as well to improving the standing point that it is now as just as a product of nature. And so highlights both sides of that, where the clinical studies can address that gap, and then also we can improve the actual actives for better use in therapy practice.